Welcome back. Today we're going to talk about depression and how depression has an impact on our thinking, feeling, behavior and physiology in our body. For any illness, usually there are prodromal signs. By prodromal, we mean signs or symptoms that they are with low frequency or severity, and they might happen randomly, without repetition, without full strength, and without duration. Just signals indicating that something else is approaching, which might be transient or severe. So, for example, with depression, someone's thinking style might be affected. So they might have or behavior or physiology or emotions. They might procrastinate. So one sign of depression is that people postpone things. They feel boredom, or they feel fatigue, and they don't complete actions. So how we find and identify these prodromal signs is very important, and how we prevent depression is very important. And again, there are other steps we do, or similar steps we do, when someone exhibits symptoms and signs of depression. So for example, if the prodromal signs of procrastination or fatigue or irritation are quite prominent, then the first step is to discuss it with a psychiatrist or a specialist, usually a medical doctor. And then if there is need, to see a psychologist, or after you get the medical opinion and the examination, then you can involve yourself with activities that they help you to promote better sleep, better diet, better intake of water, and better creative activities during the day. That is for prodromal. And equally for the creative activities, it is important that one keeps their body active and they do things that they thoroughly enjoy. Then if someone has depression, if they are diagnosed with depression and they are at the initial stages or later on, it's very important that they get a medical expert's opinion or a psychiatrist's opinion, see a clinical psychologist or another specialist psychologist, it is suggested from the medical doctor. And equally they can do activities themselves about their thinking, the feelings, their behavior and physiology. So it's important for depression that people understand when they experience in their mind and in their body depressive, pessimistic thoughts. They need to understand how often they do them, whether they do them for themselves, for the others, and the future. One of the models that we know identify 3 things important for someone who experiences depression: how they see themselves, how they see others, and how they see the future. And then we need to help them change these thinking patterns to positive, optimistic thinking patterns. And for this, we're going to dedicate a full lesson or a full video for changing these negative automatic thoughts about depressive background or experiences. Similarly, for the feelings, if someone has depressive feelings, despair, sadness, disappointment, lack of motivation, it's important that these negative feelings are replaced from positive. And one technique is instantly to do something, an activity with the body, to go for a walk, to go for a run, to cycle somewhere, to go for yoga, or to go dancing, or to go for a massage. So this is in relation to the feelings. So we need to change the feelings.